Hey all, so today I will be discussing Frotteuristic disorder. The diagnostic codes are typed down below for you guys. So here we go. Frotteuristic disorder is one of 8 paraphilic disorders which are divided into 2 categories. You have anomalous activity preferences and anomalous target preferences. Anomalous meaning to deviate from what is normal, expected, or standard. Anomalous activity preferences are then subdivided into 2 further groups. You have courtship disorders, which resemble distorted components of human courtship behavior. The 3 disorders that fit this category are highlighted in red for you. And as you can see, Frotteuristic disorder fits that criteria or category. You have algolagnin disorders, which involve pain and suffering. Then you have anomalous target preferences. Only one disorder is directed at other humans, and then you have the last 2, again highlighted in red, that are directed elsewhere. History and etiology. So the term frottage derives from the French word frotter, which means to rub, and Richard von Krafft-Ebing, I believe is how his name is pronounced. I might be butchering, so forgive me. But he is credited to describing this behavior in his book. Again, I'm probably gonna butcher this. Psychopathia Sexualis, back in 1886, which is one of the first texts to talk about sexual pathology. The book itself covers a wide range of paraphilias and also addresses areas like homosexuality, particularly in males. Um, However, when it comes to exact etiology, it's actually very unknown, and from what I've seen, very under examined. However, there are several theories that indicate that perhaps childhood traumas such as sexual abuse or anxiety disorders may cause difficulties in normal psychosexual development. Theories like these are often rooted in a psychoanalytic perspective, so keep that in mind. There is another theory regarding biology, especially with neurotransmitters, the monoamine pathways such as dopamine and serotonin, as there being a potential relationship between excess levels of said neurotransmitters and a relationship with the abnormal sexual behaviors and or interests. Moving on. So here we have the diagnostic criteria and features of the disorder. So there are only 2 criterions. Criterion A looks at the qualitative nature of the paraphilia, and criterion B looks at the negative consequences of the paraphilia. And this goes for all 8 paraphilic disorders, not just Frotteuristic disorder. So when it comes to Frotteuristic disorder, A, recurrent and intense sexual arousal from touching or rubbing against a non-consenting person as manifested by fantasies, urges, or behaviors over a period of at least 6 months. And B, the individual has acted on the sexual urges with a non-consenting person or the sexual urges or fantasies, causing clinically significant distress or impairment in social, occupational, or other important areas of functioning. So again, qualitative nature, criterion A, negative consequences, criterion B. You may also be able to specify if in a controlled environment, which is applicable to individuals living in an institutional setting or other settings where opportunities to touch or rub someone non-consenting is restricted, and or specify if in full remission, which would be individuals has not acted on the urges with a non-consenting person. There has been no distress or impairment in social, occupational, or other areas for at least 5 years while in a uncontrolled environment. Diagnostic features. So the criteria can be applied to individuals who freely disclose this paraphilia, as well as those who deny any sexual attraction or arousal from touching or rubbing someone consenting. Something referred to as recurrent Frotteuristic behavior basically refers to touching or rubbing 3 or more victims on separate occasions, obviously unconsenting. And for criterion A, keep in mind that the 6-month period it's just a general guideline. It's not a strict threshold. So if there is clear evidence over a short period of time, you might be able to give this diagnosis. Assessment. So assessments can be either given by the clinician or can be self-administered by the individual with the paraphilia. And the measures often address one of two things, either the strength of the paraphilia or the seriousness of the consequences. So again, thinking back to the two-pronged approach of diagnosing for this. Typically, when it comes to assessments, what ends up happening is you look at the fantasies, urges, or behaviors of the examinee, and you would compare that and how it stacks up against what would be normalific sexual interests and behaviors. Again, this would be either assessed by the clinician or be self-administered. Prevalence and course. Regarding prevalence and course, it is estimated that frotteuristic acts may occur in up to 30% of all adult males in the general population. It is also estimated that approximately between 10% to 14% of adult males with a paraphilic disorder may also meet the criteria for frotteuristic disorder. And of course, research across the board finds that substantially fewer females have futuristic preferences than males. So typically, paraphilias are found more in males than in females. However, we should keep in mind that there is not an exact quote-unquote population of people with frotteuristic disorders, but researchers estimate that it is unlikely to exceed the findings found in clinical settings. Additionally, adult males usually become aware and report of their sexual interest for touching someone unsuspecting during late adolescence or as they transition into adulthood. And factors that are subject to change with or without treatment, such as hypersexuality, sexual impulsivity, psychosocial impairment, age, etc., may cause course to vary from case to case, person to person. And some believe that as you age and especially in advanced age, there might be an association with a decreasing interest for frotteuristic sexual preferences and behavior. Cultural considerations. As stated before, men typically present preferences for atypical sexual interests and are subsequently diagnosed more frequently for paraphilic disorders than women. And majority of studies reference men, while women are typically underexamined. So this begs the question, could this contribute to some sort of stigma? I do not know. I leave that up to you guys to decide. Risk and prognostic factors. So, non-sexual antisocial behavior and hypersexuality might be non-specific risk factors. However, the relationship and specificity with frotteurism is uncertain and unclear. In part because when it comes to antisocial behavior and conduct disorder, there is a tendency to, go against the norm. So keep that in mind. And here we have differential diagnosis and comorbidity. So as mentioned, conduct disorder and antisocial personality disorder is characterized by norm breaking and antisocial behaviors. However, specific sexual interest for touching or rubbing someone non-consenting would be lacking. There might be also substance use disorders as differential diagnosis, especially when it comes to the usage of stimulants such as cocaine or amphetamines, which might induce a frotteuristic episode, but again, would typically not have occurred without the presence of said substance. Comorbidities, when addressing comorbidities, most of what is known is largely based on research done with male suspects who have been convicted or suspected for criminal acts involving sexually motivated touching or rubbing someone non-consenting. There also appears that those who have Frotteuristic disorder might be might meet the criteria for other paraphilias, um, as highlighted earlier in the presentation. Other things to keep in mind are conduct disorder, antisocial personality disorder, depressive disorders, bipolar disorders, anxiety disorders, and other substance use disorders, which clinicians might want to evaluate for separately. Treatment and management. Due to the severity and lack of research, treatments for Frotteuristic disorder vary greatly. Regarding therapeutic models, you have psychotherapy, CBT, relaxation therapy, and psychoanalysis. And B, you have antidepressants, which, depending on the research you come about, might be beneficial or not, because again, as stated earlier, there appears to be some sort of link between things like dopamine and serotonin and Frotteuristic behavior and or interest. There appears to be a link, especially with excess dopamine and serotonin. So how you view this depends a lot on the research that you find and how the research is presented. So I'll leave you with that. And here we have a brief case. John, a 27-year-old white male, works as a banker and lives alone. He comes to you after a few incidents at work, which have caused him to lose his job. 4 months ago, he was written up for inappropriately touching unsuspecting colleague, to which John claims to have been on accident, not on purpose. He says a similar interaction had happened 3 days after that with a different colleague, but again, claims to have been on accident. John was written up again and asked to leave the building and take a few days off. He was then told by his boss if his behavior did not stop there would be quote-unquote severe consequences. When discussing with him, John fails to elaborate on how exactly he came to touch his colleagues. John denies any feelings of arousal or sexual attraction. Eventually, a third colleague was inappropriately and unsuspectingly touched, which led to John being fired. He is now dealing with the stress of being unemployed, as he is running through his savings in order to stay on his feet, and is now at risk of being evicted from his apartment, as he has not paid his rent in the past 3 months. In order to cope with his levels of stress, John openly admits that he is using marijuana. So there's a lot there to unpack. Think back to the criteria where I mentioned that the criterions can be applied to people who freely disclose their paraphilia or do not freely disclose their paraphilia. John, in this case, isn't disclosing much. He claims that it was on accident. He denies feelings of any sexual attraction or arousal. He doesn't elaborate further on how he found himself in those situations. Also, think of the time frame which we talked about. The 6 months is a general guideline, not a strict threshold. From what we have here, it appears that this all happened within a 4-month span, and it happened to 3 separate individuals. So think of recurrent Frotteuristic behavior. As mentioned earlier, there might be some potential comorbidity when it comes to substance use disorders. So we have here John admitting that he uses marijuana, but we should not jump to conclusions. He openly admits to using marijuana, but there's no specificity as to how much he takes or how often he consumes it. So this case, I believe, is an accurate representation of someone you would find with Frotteuristic behavior or Frotteuristic disorder.